everyone, this is Rose-BSN3B, a BSN3B student from section PEPLAU. And for today's video, I'm going to perform or demo the Geriatric Nursing Vital Signs Assessment. So first, we have to assess the body temperature of the patient. It is where we are monitoring the body temperature of the patient using clinical thermometer. So the things that we're going to use is digital thermometer, tissue, gloves, and also your blue or black ball pen for documentation. So first, you have to perform hand hygiene to decrease the spread of microorganisms. Then after that, we have to prepare all the equipments that we're going to use to facilitate an organized performance or procedure. Then we have to explain the procedure to our patient. Hapon la, ako gali ang imo nga nurse subong. So akong pangalan is si Rose Garcia. Sa subong makakagali sa imo nga temperature. Okay, so magamit ta digital thermometer. So after that, after explaining to the patient, we have to provide privacy by providing screen or closing the door. So first, before we putting this thermometer to the patient's axilla, we have to clean it first. So by using the alcohol, so we have to wipe from the area where few organisms are present. Then after that, discard. After wiping or cleansing the thermometer, we have to assist the client in a supine or sitting position to have an easy access to the axilla. So, nakapungko na siya. Then, kakson ang bayo. So, mababota na nila. So, after exposing the axilla of the patient, we have to make sure that the patient's axilla is dry. So if it was moist, we have to pot it until it was dry. So since moisture will alter the result of the patient's temperature, then after that we have to turn the thermometer on. Then after turning on the thermometer, we will place it on the patient's axilla. So make sure that the bulb is contacting or in contact on the patient's axilla and hindi sa bayo. That we have to place our patient's arm on the chest. So after putting the thermometer, we have to wait for the thermometer to beep, and then after that, we have to explain the result to the patient. It's either she has hypothermia or hyperthermia. So nagtingog na or nag-beep na ang atong thermometer. So kaksunta na siya. Pwede mo na lang mabalik yung mga pwede mo na mabuta yung mga kamot. So ang imo temperature la kay 37.2. So wala ka man hilanat. Normal lang na siya.
Wala na inakira pagnawan ko.
Then so after that, after getting the patient's temperature, we have to clean our thermometer as well. That we have to wipe the thermometer from the stem to bulb using the alcohol and also the cotton. So after getting or explaining the result of the patient, we have to perform hand hygiene to decrease the spread of microorganisms. Then we have to record or document the result. So next procedure is assessing the radial pulse. So it was checking for a presence of rate, rhythm, and volume of throbbing of the artery. So the equipment that we will be needing is wristwatch with second hand as well as blue or black ball pen for documentation. So first, we have to perform hand hygiene to decrease the spread of microorganisms. Then after that, we have to explain the procedure and the purpose of the procedure to our client or to our patient to gain patient's operation and to give them some information about the procedure that we're going to conduct. So, mayong hapon la, ako gali si Rose-BSN3B. Ako gali ang mga nurse sa Subong and sa Subong mako ako sa imong pulso. So, ginahimo tani kay para ma-check ta kung ano ang kakusugon, ang kadasigon kag ang volume sa imong pulse. So, after that, we have to assess our client in assuming a supine or sitting position. So, this was to provide and see access to a pulse site. Then, in a sitting position, we have to bend our client's elbow in 90 degrees. So, 90 degrees angle. 90 degrees angle and support the lower arm on chair or on examiner's arms. Slightly flex the wrist. Then after that, so this was to relaxed position of forearm and slight flexion of wrist promotes exposure of artery to palpation without restriction. Then we have to place the tips of our first, index, and third finger over the client's radial artery on the inside of the wrist or on the thumb side. So here, after placing the tips of our first, index, and third finger, we have to apply only enough pressure to radial pulse. So moderate pressure facilitates palpation of the pulsations. Then we have to use our watch, count the pulse beats for a full minute. So, after getting the patient's pulse rate, we have to record or document the result on the patient's chart. So, documentation provides ongoing data collection. Then, after the documentation, we have to perform hand hygiene or wash your hands to decrease the spread of microorganisms. Next procedure, I'm going to demo the assessing of patient's respiration. So it was a measuring the chest rise and fall, so it could be counted as one. This procedure or assessing the patient's respiration was done to determine the respiratory rate occurring per minute. Then it is to gather information about the rhythm and depth, and also to assess response related to the patient's medication or therapy. First, you have to make our client's position comfortably in a sitting or lying position. So in lying position, we have to elevate the head in 45 or 60 degrees angle to provide a clear view of the chest wall of the patient. Then we have to prepare for count respirations by keeping our fingertips on our client's pulse. Then, after getting the respiration rate of the patient, we have to always remember to document the results on the patient chart, and also to perform hand hygiene to prevent the spread of microorganisms. For a last procedure is assessing the patient's blood pressure. So it is a measuring the patient's blood pressure used by using palpation or sphygmomanometer. So the equipment that will be needing is sphygmomanometer, stethoscope, alcohol swab, your ball pen, and also notebook for documentation. So next, we have to gather all the equipment that will be needed to facilitate an organized performance of the procedure. Then we have to cleanse the earpiece of our stethoscope as well as the diaphragm.
So this was to prevent the spread of infection.
Then after that, we have to let the client rest for at least 5 minutes to avoid a falsely elevate readings of the patient's blood pressure. So next, we have to assist our client in a comfortable position. Then we have to remove a constricted clothing to allow an easy access to the brachial artery, easy access to the brachial pulse easily, and also to measure the patient's blood pressure accurately. So, lakak sa So, for our palpate brachial artery, center the cuff's bladder approximately 2.5 cm or 1 inch above the site where you palpated the brachial pulse. So, center the bladder, ensure even cuff inflation over the brachial artery. Then, we have to wrap the cuff snugly around the client's arm and secure the end approximately. So, loose fitting cuff cause fake high readings, and approximately way to wrap is we have to put our 2 fingers between the arm and the cuff. So, wrap the cuff snugly around the client's arm and secure the end approximately. Two fingers between the arms and the cuff. Then, pause na yun. Palpate brachial pulse distal to the cuff with fingertips of one dominant hand. Then close the screw clamp of the bulb and inflate the cuff while still checking the pulse with other hand. Then after that, observe the point where pulse is no longer palpable and inflate cuff to pressure 20 to 30 mmHg above point at which pulse disappears. And open the screw clamp, deflate the cuff fully, and wait for 30 seconds. For auscultation, position the stethoscope's earpieces comfortably in your ears and be sure that sounds are clear, not muffled. Then place the diaphragm over the client's brachial artery to ensure that optimal sound reception. Then, we have to close the screw clamp on the bulb and inflate the cuff to a pressure 30 mmHg above the point where the pulse had disappeared. Open the clamp and allow the aneroid dial to fall at rate of 2 to 3 mmHg per second. Note the point on the dial when first clear sound is heard, then continue deflating the cuff and note the point where the sound disappears. Then, release any remaining air quickly in the cuff and remove it. Then, if you must recheck the reading for any reason, allow a 1-minute interval before taking blood pressure again. So, after placing the patient in a comfortable position, we have to perform hand hygiene and we have to return all the equipments that we used this proper place and discard. So that would be all. Again, this is Rose-BSN3B student from section PEPLAU. Thank you and God bless us all.